Did you know your skin can reveal signs of diabetes? Today we're going to explore this topic in depth. Your skin is like a canvas painting a picture of your internal health. It's the body's largest organ, and it often provides the first sign of an underlying condition. One such condition is diabetes, a disease that affects millions worldwide. The correlation between skin signs and diabetes is more significant than you might think. Being in tune with your body and its signals is crucial. It's all about awareness. Recognizing unusual skin signs can be your first step towards early detection of diabetes. And early detection, as we all know, can make a world of difference in managing the disease. So, what kind of skin signs are we talking about? They range from common symptoms like dryness and itching to less familiar ones like yellowish skin or dark patches. Now let's dive into the 10 unusual skin signs that could indicate diabetes. The first unusual skin sign is the presence of dark patches. Now, these aren't just any random dark spots. We're talking about patches of skin that have noticeably darkened, particularly in areas where your body folds or creases. This could be under your arms, around your neck, or even behind your knees. This condition is known as xanthomatosis nigricans. It's a skin condition characterized by dark, velvety patches in body folds and creases. And here's the kicker. It's often associated with insulin resistance, a key factor in the development of type 2 diabetes. The patches may appear gradually or develop suddenly. They could feel a bit thicker than the surrounding skin, or even slightly itchy, but the main identifier is the change in color. Dark patches can be due to various reasons like sun damage or age spots, but if you notice this change in your skin, particularly in body folds and creases, it's worth getting it checked out. After all, your skin is your body's largest organ, and it can tell you a lot about what's happening inside. Next, we move on to a yellowish hue to the skin. An unexpected tinge of yellow can be a sign your body is dealing with higher than normal levels of carotene in the blood. Now you might be wondering, what does carotene have to do with diabetes? Well, it's all about how your body processes and uses the nutrients it receives. Carotene, a nutrient we get from certain fruits and vegetables, is normally converted into vitamin A by the body. However, in some individuals, particularly those with diabetes, this conversion process doesn't work as well as it should, leading to an accumulation of carotene in the blood. This buildup can then manifest as a yellowish tint to the skin. So if you notice your skin taking on a more golden hue, it could be your body's way of flagging a potential issue. Keep an eye on any unusual yellowish tint to your skin. Another unusual skin sign that could indicate diabetes is the presence of skin tags. Skin tags, or acrocordons, are small, soft, skin-colored growths that hang off the skin and look a bit like warts. They're very common and harmless, often appearing in areas of the body where skin rubs against skin, like the neck, armpits, or under the breasts. But what's the connection between these tiny skin protrusions and diabetes? Well, research suggests that skin tags may be a sign of metabolic syndrome, a cluster of conditions including increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Metabolic syndrome increases the risk of heart disease, stroke, and type 2 diabetes. Therefore, skin tags could potentially indicate an underlying insulin resistance, a key factor in the development of type 2 diabetes. So, if you notice an increase in skin tags, it may be time to check your blood sugar levels. Itching and dryness, though common, can also be signs of diabetes. Now, we all know that feeling of dry, itchy skin after a long day in the sun, or perhaps during those harsh winter months. But when these symptoms persist, they could be indicative of something more serious. You see, our bodies are like well-oiled machines, and just like any machine, they need the right balance of fluids to function properly. Diabetes, however, can disrupt this balance. It often leads to dehydration, which in turn decreases the moisture levels in our skin. This lack of moisture can cause our skin to become dry and itchy. Moreover, high blood sugar levels, a hallmark of diabetes, can cause inflammation in the skin. This inflammation can lead to persistent itching, which is not only uncomfortable but can also lead to other skin problems if not addressed. So the next time you find yourself reaching for that bottle of lotion more often than usual, take note. Stay hydrated and moisturized, but if the problem persists, it's worth investigating. Shin spots or diabetic dermopathy is another unusual skin sign linked to diabetes. Diabetic dermopathy is a skin condition that appears as light brown, scaly patches. These patches, often round or oval, are commonly found on the shins, hence the name shin spots. They might look like age spots and are often mistaken for them. So how is diabetic dermopathy connected to diabetes? You see, diabetes affects the body's ability to use and store sugar, which can lead to various complications, including changes to the skin. The changes in small blood vessels caused by diabetes can lead to diabetic dermopathy. These spots are usually harmless and don't need to be treated. However, they serve as a sign that your blood sugar level may not be under control. Remember, your skin is like a billboard for your health. These small, round brown patches on the skin should not be overlooked. Necrobiosis lipoidica is another rare skin condition associated with diabetes. This condition is quite unique, appearing as shiny and smooth patches of skin that slowly grow over time. The affected areas, often on the legs, start off as small, raised bumps and gradually evolve into larger patches. These patches have a yellowish hue with a thin, purplish border that gives an almost bruised look. Necrobiosis lipoidica affects a small percentage of people with diabetes and is more prevalent among those with type 1 diabetes. However, it can also occur in people without diabetes, albeit less frequently. The exact link between diabetes and this skin condition is not entirely clear, but it's believed to be related to changes in the blood vessels that supply the skin. This condition is not contagious or life-threatening, but it can cause significant discomfort and cosmetic concern. Early detection and treatment can help manage the symptoms and prevent further progression. Although it's rare, it's a clear sign that should not be ignored. The seventh unusual skin sign is a condition called Granuloma annulare. Now, this is a bit of a mouthful, but essentially it's a type of chronic skin condition that presents as raised, ring-shaped patches on the skin. These patches may appear reddish, purple, or skin-colored and can pop up anywhere on the body. However, they are most commonly seen on the hands, feet, and wrists. Granuloma annulare is not exclusive to people with diabetes, but studies have shown a potential correlation between the two. It's been suggested that elevated blood sugar levels might trigger the immune response that leads to these skin changes. But it's important to note that this isn't a definitive sign of diabetes. Many people with granuloma annulare don't have diabetes, and many people with diabetes don't have granuloma annulare. While this condition can be harmless, it's still worth checking your sugar levels if it appears. Knowledge is power, and understanding these unusual skin signs could be your first step towards managing your health better. Eruptive xanthomatosis is another skin condition linked to diabetes. This condition is marked by the sudden appearance of small, firm, yellowish bumps on the skin. These bumps are surrounded by a reddish halo and can sometimes be itchy or tender to touch. Eruptive xanthomatosis is not just a random skin outbreak. It's a sign that your body is struggling with fat levels because of uncontrolled diabetes. When diabetes is poorly managed, the body can't effectively use insulin. This leads to high levels of fat in the blood, which can then deposit in the skin, resulting in these distinct bumps. These bumps commonly appear on the buttocks, thighs, crooks of the elbows, or backs of the knees, but can show up anywhere on your body. They tend to clear up when diabetes is brought under control. So, if you notice these unusual bumps on your skin, don't dismiss them as just another skin issue. This condition is often a clear sign of uncontrolled diabetes. Digital sclerosis is another skin condition that can indicate diabetes. This particular skin condition is characterized by tight, thick, waxy skin that develops on the back of the hands and sometimes on the toes and forehead. The fingers can become stiff and difficult to move. If you're wondering how this is linked to diabetes, let's dive a little deeper. High blood sugar levels can cause many changes in the body, one of them being the thickening and hardening of the skin, which is essentially what digital sclerosis is. This condition is more common in people with type 1 diabetes, but it's not exclusive to them. The good news is, much like the other skin signs we've discussed, digital sclerosis can improve with better control of blood sugar levels. That's why recognizing it early is so important. It's your body's way of telling you that something needs to be addressed. This skin condition is a clear sign that your blood sugar may be too high. The last unusual skin sign we'll discuss is blistering. Now, blisters can occur for a variety of reasons, but when they appear without any apparent cause, it's time to pay attention. Diabetes can lead to a rare skin condition known as bullosis diabeticorum, or diabetic blisters. These blisters often resemble burn blisters and can occur on fingers, hands, toes, feet, legs, or forearms. Here's the interesting thing. Diabetic blisters are painless and typically heal on their own. However, they are a clear sign that your diabetes is not well controlled. High blood sugar levels make skin more susceptible to damage and infections, leading to such conditions. So, if you notice unexplained blisters, especially if they're large or seem to be spreading, it's crucial to consult your healthcare provider. it might be a sign that your diabetes needs better management. Remember, blisters without any apparent cause should be checked out. To summarize, the skin is a mirror that reflects your internal health. We've taken a closer look at 10 unusual skin signs that might be signaling something more serious beneath the surface, like diabetes. Dark patches, yellowish skin, and skin tags can all be early indicators of the disease. Dryness, itching, and the appearance of conditions like diabetic dermopathy, necrobiosis, lipoidica, and granuloma annulare can also suggest that your body is struggling with high blood sugar levels. More rare but equally important to watch out for are eruptive xanthomatosis, digital sclerosis, and unexplained blistering. Each of these skin signs gives us a unique insight into the body's internal workings, specifically the way it processes glucose. Remember, early detection can make a huge difference in managing diabetes. So if you notice any of these skin signs, don't ignore them and consult with your healthcare provider.